Welcome to another episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Welcome, everybody, again to another episode of our show, bringing you another really fascinating guest today, helping to create a better tomorrow for many people out there. Today, we have the honor of being joined on our virtual road trip, headed off to Auckland, New Zealand today to meet up with none other than Dr. Brad Stanfield, who is a general medical practitioner from New Zealand. Dr. Stanfield graduated back in 2015 from the University of Auckland with his medical degree. He worked in hospitals for several years, including as an orthopedic registrar before moving into a general community practice. Dr. Stanfield is also the host of one of my favorite YouTube channels, the rapidly growing Extend Healthspan channel. He has over 121,000 subscribers currently, where he likes to, when he's not treating patients, he likes to spend his spare time dissecting data from a broad range of ongoing and finished studies focused on therapeutics, supplements, various biohacks to ultimately tell folks what may work, what may not work. He also, is just really exciting and on the front of a lot of activity happening in this emerging lifespan, health span space. We're really honored to have him with us today from the other side of the globe. But Dr. Brad Stanfield, thank you so much for taking the time this morning to come on the show.
Yeah, thanks, Ira. It's a pleasure to be here.
Yeah, it's great having you, Brad. Obviously, you have this fascinating Extend Healthspan show, a rapidly growing population, and a lot of us know you based on sort of the healthspan science. But I was looking back sort of into the scientific literature of some of sort of your older papers, things like with titles like Validation of Appendicitis Inflammatory Response in Provincial Populations and Management of Acute Sigmoid Volvulus in a Provincial Center, 20-year experience. Talk a little bit about the beginning, Brad. Just take us on a couple minutes on a little journey about you, because we know you from Healthspan, but take a little time to just talk about who you are beyond that, if you would.
Yeah, sure. I didn't exactly start medical school thinking that I'd begin a YouTube channel. So yeah, when I began medical school, I didn't exactly know what specialty I wanted to go into, but I knew that I enjoyed the challenge. I wanted to make sure that I was, seeing patients face to face, and that I was, helping them in every way that I could. So as part of my journey, going through medical school, I helped with various papers like you've mentioned, and working through the hospitals just as a regular doctor, I suppose, regular junior doctor. So as part of that, I was helping to run an appendicitis study. So we were trying to figure out a quick way for the emergency department to actually figure out, does that patient sitting in front of you have appendicitis or not? Because appendicitis can mimic a lot of different diagnoses. So we wanted to see, is there a particular score that we could use to stratify the risk of that patient in front of us having appendicitis? So certainly nothing to do with health span or lifespan in terms of what I do now. But along my journey, I started to notice some wrinkles in my around my eyes, and I've always been interested in supplements and sports. So I wanted to see, what actually can we do to slow the aging process? Because medicine is quite good for treating, heart failure, for preventing heart attacks, but what about actual aging itself? So that kind of got my journey started. And then I've had no training with YouTube. I just wanted to create a resource that people could go to actually look at the human clinical research. Because what I realized was that a lot of other websites and channels, they were focusing on cell data or mice data and then extrapolating that to humans. And that was leading some people down interesting paths that probably were futile. So I wanted to create somewhere that people could actually say, has this been tested in humans? Are there any benefits or not? Because, there's truckloads of supplements out there, but there are a few gems that I think, most people should be taking. And the other thing that that I also want to emphasize is that, supplements are the cherry on top. It's the diet, exercise, and sleep that really matter at this stage for health span and lifespan. So that's, a bit of my journey.
Excellent. Excellent. It's interesting because when I have guests on the show, it's sort of from this what I sort of call this evolving health span, sort of longevity biotechnology space. I sort of fractionate it into three different areas. On one hand, we have, what I'll call, as you were saying, sort of those bench researchers that are out there, got a lot of them. They're great at, studying things and curing aging, dealing with aging, and in the rats and the mice and the nematodes and so forth. Then we have some less, but nonetheless, we've done some shows with the translational researchers trying to figure out, okay, how do we take some of that data from the rats and the mice and we move it into humans? How do we decide what we study and so forth? Ultimately, working with humans, but again, small population in terms of what we need in those clinical trials. Then we have the Dr. Brad Stanfield, and you are what I put in a class of sort of the real world practitioners, and your population is the 8 billion people out there. And as you know, based on your work, we can learn a lot in a clinical trial with 5,000 people. But even in this day and age of 2022 with precision medicine and everything we know about pharmacogenomics, those 8 billion people, we still don't know really the details of what is behind aging processes. Talk a little bit about this side of things. I think we don't focus on it enough in the aging science community about how much there still is to learn from real world patients and practice of medicine.
Yeah, so I think that's the point. We need to try and make sure at the end of the day that we are helping the patients in front of us and helping the 8 billion people in the world. So the practice that I work at, so I work there 4 days a week. And it's not a longevity clinic. It's a regular general practice clinic. And I've specifically done that because I wanted to make sure that I was speaking to real world people. So I'm dealing with in the particular practice that I'm at, it's semi-rural. So, I'm dealing with rip-roaring heart failure, diabetes, blood pressure in the 200s, quite sick patients. And, what can we do with current medicine to improve their health and improve their lifespan and health span? And I like that because it gives me a different lens, I suppose, compared to, say, the researchers that you've currently mentioned. So for those patients, what are the things that truly matter for them to improve their health? Well, number one, it's diet. Most of the time, they're having a high salt diet, they're drinking too much alcohol, they're in calorie excess, they're not exercising, and they're not sleeping particularly well because they might be suffering from sleep apnea. There's all these things that need to be addressed first, and getting them on the correct medications if that's what's required. And only after all of that do the supplements and whatnot actually come into it. So for those patients, I think if I start talking to them about interesting aging research and whatnot, that's I think kind of defeats the point, because there's so many other things that we need to go through with that patient to get them on a healthy trajectory first. So I think that's the thing that I want to try and emphasize is that, for most people, we need to be focusing on diet, exercise, sleep, getting the basics correct. And then we can start looking at these interesting, supplements and so-called anti-aging strategies.
And along those lines, because I really enjoyed your interview with Brian Kennedy from a couple of months ago, National University of Singapore, and there again you were talking about what happens when someone comes into your clinic. You said, hey, we talk about social determinants, we talk about mental health. Are you getting enough sleep? You pointed out to the very interesting research on hearing loss and sort of the connection with dementia. So you're really taking sort of very holistic approach there. What just interestingly, as you were just saying, you can't just jump into a discussion about health span and give them some metformin right away. What type of feedback are you getting though from some of these patients when you do bring up that topic? Because I know everyone's sort of redirecting nowadays in 2022 towards this principle of health span. Do you see that terminology out there sort of in the popular lingo yet, or is it still something that we really have to do a better job of educating people about? Because I bring it up with my in-laws who are, they're in their 80s and they stare at me. Like, what are you talking about? You make me a little healthier. What are some of the feedback you're getting from your patient base on this theme of health span?
So in I suppose the real world, I don't think it's really caught on. I
Yeah.
think that the patients that I'm seeing, we need to make sure that they are remaining strong as they get older, because they care about things like, can I toilet myself? Can I shower myself? Can I still play golf? Can I see my grandkids? Those are the things that the older patients that I see really care about. So I need to make sure that their heart is functioning as optimally as possible. I need to make sure that they are doing some form of resistance training so that they're trying to hold on to their muscle strength. I want to make sure that they're recovering from that exercise correctly. Again, I want to make sure that they're not becoming isolated, because a lot of older people, once they start losing family members and friends, they do start to become isolated. So I need to make sure that they've got a rigorous social life. They need to be seeing people. So I think those are the things that truly matter in the real world, less so the health span and lifespan discussion, I suppose, because what we're trying to do is make sure that person is as healthy as possible anyway. So I don't think talking to them about the difference between health span and lifespan is particularly useful, because we just need to make sure, again, that they're doing the exercise, they're sleeping, they're eating, and on the point of of dementia and hearing loss. So most people over the age of 50, that they might be taking supplements to try and slow down the aging process or clear away senescent cells. Whereas one of the best things that they could possibly do is test their hearing to see if they do have early onset hearing loss. Because if that's not treated with a hearing aid, that in itself significantly increases the chance of developing dementia. So you need to make sure that you're treating the basics correctly. So there's so many things that we can be doing now to prevent cancer, to prevent dementia, to prevent muscle loss as we get older. And again, I like the lens that I look through, because I'm seeing patients sitting in front of me, 4 days in the week.
And another really interesting thing, Brad, about you and your channel, aside from doing these reviews on a lot of the studies out there, you also focus in on your own sort of personal regimen, the stack that you talk about, the things you take, the things that you've been taking. You decided based on new data, I'm not going to take this anymore. And aside from sort of this personal sort of clinical study that you're doing on yourself and talking about and providing the data to the world, there's something very else interesting there to me, and that is this principle of sort of combination therapy. And this is something that I come out of the pharmaceutical industry, and for decades, and still it's pretty tough today. It's always very difficult to study things in combination. Usually happens decades after sort of your drugs are approved, and once you have enough money, you come back and if we put X and Y together, does that have an additive effect or synergistic, what have you? But in some of the work that you're doing, where you're sort of combining biohacks and supplements and maybe repurposed medicines, you have ability once again to look through a different lens. Talk a little bit about your current stack and a little bit of sort of the way you go about sort of just evaluating your own sort of combination protocol of one.
Yeah, so you're absolutely correct that we don't have the human research at this stage looking at a lot of combination therapies in this health span, lifespan space. What I will say is that in spaces such as heart failure, we've got fantastic research on combination therapies.
Yep.
So I think it will come, but the field is relatively early. So what I try and do is look at what compounds have been placebo controlled in randomized clinical studies that actually show a benefit. So one of them that I think most people should be taking is creatine. I think that's one of the most underrated supplements in the health span, lifespan field. Creatine is brilliant. It improves muscle performance in your initial workouts. It helps with muscle recovery. It may even help with cognition. It reduces injuries. So, there's supplements such as that I think have got very compelling not only efficacy data, but safety data as well. So that's a supplement that I take. Then I look at something like collagen. When I first looked at collagen, I thought it was complete nonsense because, how could you be absorbing these long collagen chains, and how could that actually be causing an improvement in human health? But we've got, multiple placebo-controlled human studies showing that collagen peptide supplementation improves skin health. And if it's improving skin health, what other organs is it helping? Is it helping your blood vessel health? Is it helping, your joint health? And when we combine that research together in what's called a meta-analysis, again, we see those positive effects. It's a similar thing with omega-3. So yes, we don't have research on combination therapy, but for a few supplements out there, we've got very compelling individual data. So again, the creatines, the omega-3s, etc.
And continuing along those lines, in addition to your practice, in addition to your channel, you've been, a major proponent of rapamycin and developing this rapamycin study. And rapamycin has been obviously it's been at the top of many people's lists in terms of repurposing possibilities for aging and health span. We've done a couple shows on rapamycin, sort of looking in the opposite direction at sort of orphan niche conditions. We did one on something called Castleman's disease and another on something even rarer called Proteus syndrome, which are these weird sort of hyperproliferative disorders. Others are looking at rapamycin in the other direction, sort of really grand scale stuff in terms of the basket of sort of physiological endpoints. But in your particular case, you have a very interesting study design where you're looking at low dose rapamycin combined with exercise and really just looking for an interesting signal, whether there's a synergy here. I think this is very elegant because, again, a lot of what's happening in this space, unfortunately, it's going to be a while for that signal to occur when you're looking at big baskets of diseases. Here, you're looking at a little something shorter term to really validate a aging endpoint. Talk a little bit about why you got interested personally in rapamycin and sort of the status of what you're doing with this study.
Yeah, so rapamycin is, I think the most exciting molecule that we've got in the health span and lifespan space. And the reason for that is there's a program called the Interventions Testing Program. Yeah. So what this program does is it runs the same experiment in 3 separate labs in genetically diverse mice, and it gives them a compound to see what happens to their health span and lifespan. And over again, we see lifespan extension of about 20% for both male and female mice. And that's really exciting. So it's high time that we actually test this in humans, but we need to make sure that we're actually designing the study so that we can see a firm endpoint. So if we look at, if we try and design a study looking at, will this reduce mortality? Will it reduce death rates? We're going to be waiting decades. So that's not a particularly feasible study design. What is interesting though about rapamycin is that I think if you combine it with exercise, we'll see greater muscle performance improvements compared to just exercise alone. So again, because I see a lot of patients in my clinic who are older, they're beginning to lose their muscle mass, they're beginning to lose their strength and their independence. So I'm very interested in coming up with ways that synergize with exercise to help those patients hold on to their muscle strength. And that in itself, we can, if this works, we can stop patients from becoming frail. And if they do become ill with pneumonia or something, then they've got a bit more reserve to fight it off. So if this works, I think we're going to see, other benefits that come along as well in terms of dementia rates and whatnot. But coming back to my study, I think this is going to work because of the mechanism of how rapamycin works. So when we exercise and when we take in protein, we activate an enzyme called mTOR. And mTOR is a nutrition sensing enzyme, if you like. It's a growth pathway. So if you activate this, you will start building your own proteins and building muscle. But an interesting thing seems to happen that when we get older, mTOR seems to be chronically switched on. So you'd think that we should be getting stronger as we get older, but that doesn't actually seem to be the case. And that's likely because if we're switching mTOR on all of the time and we're not giving and we're not switching it off, then we're not activating the cell clearance process. So this is autophagy, or where we want to try and get rid of these old cell components. So it seems that as we get older, we're collecting all of these old and damaged cell components, such as, damaged mitochondria, and they're getting in the way of the cell functioning correctly. So if we can have periods of time where we're clearing out those old components so that and then have separate times where we're rebuilding again, I think that's an interesting avenue to explore to see whether that will improve muscle performance. So how we've designed the study is, for most of the week, people will be exercising. They'll be doing some form of resistance training. So we wanted to include people that don't already do exercise, because we wanted to, at the end of our study, we wanted to make sure that their muscle performance would improve. And then we wanted to see, in combination with once a week rapamycin on days that they don't exercise, will we see greater performance improvements? So we're focusing again on functional outcomes. So it's not a blood test that's going to be the primary endpoint. The primary endpoint is, will these patients actually be stronger? Will they be fitter? Can they get up and walk faster? Those are the things that really matter. So yeah, I'm really excited about it, because I think, again, diet and exercise, you cannot overstate how important those are. So we need to come up with interventions that work really nicely alongside diet and exercise. So I think if we use rapamycin to switch mTOR off once a week, to clear out the old damaged components, and then when we're exercising, we can rebuild new components, I quite like that theory.
Yeah, and once again, coming back to as you were saying, the looking at the physiological side of this and say, is there a physiological benefit here? And be able to see it in the case of this in a short period of time compared to some of the much longer study designs that I've seen out there. That being said, what is your, as a practitioner, as somebody that sees a wide range of patients, we are, again, still in this era of, the next hottest biomarker. Obviously, epigenetic clocks are all over the press. Love to get your feeling just about them in general, about how you look at them in your practice. And then, do you have patients that come to you and say, hey, there's this $2,000 test that I can have done should I have it done, doctor? Is it beneficial? What do you tell your patients nowadays?
In the real world where I practice, I don't see this conversation coming up much at all. And when it comes to biological clocks, I think they are interesting and should certainly be researched. I'd also argue that we've already got brilliant biological clocks, and that's how the patients are feeling. That's what their cholesterol levels are. That's what their weight is. That's what their blood pressure is, what their blood sugar level is. So I think it's important that we that again we focus in on what is the end goal here. And for me, when I see a patient, the end goal is, I want to prevent heart attacks, I want to prevent strokes, I want to make sure that they're strong as they get older, and I want to make sure that they are in a good mental space, and they're socializing well and feel like they're an active part of the community. That, I think, is, and if you look at things through that lens, biological clocks, again, I think they're an interesting research tool. I'm not yet convinced that they will offer much value to general clinicians such as myself.
Another interesting tool. I went to website, or I guess the website of the previous clinic, but the first thing that popped up to me when I got to the website was this thing about downloading the digital health app, and I got it got me thinking, because as much as we talk about longevity and biotech related stuff on the show, we've also done several shows on sort of the evolving age tech space, which is different in the sense that the age tech folks realize that, okay, well, at least here in the United States, we have somewhere of 120 million people that are 65 and older. They want these interesting digital devices to help them in the process as they continue to get older. And it's a product today. What, in terms of some of the digital health applications that you run into, whether they're wearables or some of these other interesting tools that are coming down, again, talk a little bit about the real world angle on this. What's interesting to you, what you think is nonsense, and what you think it's probably we can wait a little while on before we invest the money in as patients in your clinic.
Yeah, one of the interesting wearables I think is the Apple Watch. Every now and again, a patient will come in and say, "Hey, my Apple Watch said that I've got some sort of arrhythmia," and then when we investigate it correctly with what's called a Holter monitor, so it's a monitor that they wear for 24 to 48 hours to see what's happening to the heart rhythm, we can diagnose atrial fibrillation. So that's really interesting, because then that will significantly change the treatment path for that patient. So that I think is really cool. There are some other, things like continuous glucose monitors. I think if people can afford them when they are a diabetic patient, brilliant. That over and over again in human studies, that's been shown to improve blood sugar control, and that's awesome. But then for people that are otherwise healthy, continuous glucose monitors, I'm not convinced that they offer much value. So I think people will focus too much on the blood sugar spikes that they will measure after food. So say, for example, for some people, if they eat a piece of fruit and their blood sugar level goes up on these continuous glucose monitors, they'll take that as evidence that they shouldn't be eating fruit, when that's not the correct way, I'd suppose, to actually interpret that research. So I think it's important that we're measuring things for a particular reason, and we're tracking things that will actually make positive differences to human health. There's another strategy where patients are going through full body MRI scans to try and screen for cancer. That's fraught with danger. So a classic example of this, there was a program in the United States that was looking at ways to detect early onset lung cancer and treat it. So what they did is they took, I think it was people over the age of 45, and they divided them into two groups. They said this group is just going to continue their normal life, and the other group is going to have a CT scan looking for cancer. Interestingly, it turns out that the group that was having these scans and looking for early onset cancer, that group had a higher death rate and a higher morbidity rate, because what was happening is that these lesions were being picked up, they were getting operated on when they didn't actually need to, and that through those procedures and whatnot, again, there was a higher death rate. So if they've subsequently gone back and done those studies again, but they've looked at high risk patients. So these are patients over the age of, I think it's 50, who are smokers or who have a family history of lung cancer. And for those patients, having a scan reduces death rates and reduces morbidity. So again, we need to be measuring things that actually make a positive difference to human health, and we need to make sure that those procedures have been well studied and validated to reduce death rates and morbidity. So yeah, I think we just need to be cautious of what we're measuring and make sure that we don't miss the wood for the trees.
Yeah, I enjoyed listening to you talk about that also in terms of sort of this general theme of overdiagnosis, because this is sort of an area we don't want to fall into, both from a practitioner perspective and just a sort of healthcare finance perspective. So yeah, no, that's
but
very...
on that point, it might be good just to go through things that actually make a positive difference in human health.
Sure.
Let's take the cancer route.
Yep.
So mammograms for women, they've been shown to reduce morbidity and death rates. It's the same as cervical smears. I think if you can afford it, people over the age of 50 should be having a colonoscopy. They should be screening for bowel cancer. It's a similar thing with prostate cancer. So there's once a year for people over the age of 35, they should be having a full body skin check to make sure that there's no early skin cancers that need to be removed. Those are the things that have been shown to reduce death rates that I think people need to be focusing on, again, before supplements and full body MRIs. We need to be doing the basics.
That's an excellent point. Really excellent point. Brett, looking out though, I mean, one of the obviously, we talked about rapamycin. There's sort of a lot of things in the health span basket from the perspective of repurposing, and I think one of the things that you've spoken a little bit about, that you're kind of excited about, they're sort of new on the horizon, but nonetheless are these the SGLT2 inhibitors, and develop diabetes, but having some really interesting effects on weight loss, as well as the obvious connection there and sort of the diabesity space. Talk about that a bit, and some just other stuff on the horizon that's kind of exciting to you in terms of sort of the repurposing for health span approach.
Yeah, so SGLT2 inhibitors, I think they're an awesome class of medication. So they were designed for type 2 diabetics, and in those patients, they reduce hospitalization, they protect the kidneys really well, and they seem to reduce heart attacks, which is awesome.
Mm-hmm.
And then when the interventions testing program got a hold of this class of medication, it extended male lifespan by, I think it was about 7 or 8%,
Yeah.
which is cool. Then that class of medication's been has started to be repurposed for heart failure patients, because we can see if heart failure patients are on this class of medication, there's reduced hospitalization and there's reduced death rates. So now it's routine to prescribe those medications for heart failure, even if they don't have diabetes. It also looks to be a similar thing for chronic kidney disease. It looks like this class of medication, again, since it protects the kidneys so well, it reduces kidney deterioration. And that's interesting because from about the age of 30 to 35, most people, their kidney function starts to decline.
Mm.
So if we set a very optimistic goal that we're trying to live for, 110 to 120 years of healthy lifespan, we want to be trying to do everything that we can to look after all of our organs, including our kidneys. So it's possible that this class of medication will help protect our kidneys and slow down that decline. So it has been validated for moderate kidney disease. And trials are underway for mild kidney disease. So it will be interesting to see whether, most people over the age of 35 would be on this medication in the next 5 or 10 years. I think that's going to be possibly the first so-called longevity medication that's going to be prescribed.
And others, whether they be current therapeutics or maybe I know there's other supplements that you profile on the show, but other things that get you kind of excited looking out
Yeah.
in the next couple of years.
One of the most exciting things that's happening right now is we will not have an obesity issue in the next 5 to 10 years. Obesity will be treated. And
Right.
that's through a class of medication called GLP-1
Yep.
receptor agonists. So this was also designed for type 2 diabetics, where it significantly reduced blood sugar control. And then during those trials, they noticed that people were losing a truckload of weight and their sugar cravings were gone. So that spurred the drug companies on to actually run these weight loss studies. And the weight loss that these patients were getting is just unreal. So, this is exciting because overwhelmingly, the human studies show that for most people over a roughly 2-year time frame, if they try to lose weight, at best, most of them will lose about 1 to 2 kilograms. That's it. Whereas if you combine diet and exercise with this class of medication, we're getting sort of 15 to 20% weight reduction. And with that comes lower blood pressure, lower cancer rates, lower heart attack rates. So, with this class of medication, we won't have an obesity epidemic anymore. And with that, we get all these health span and lifespan benefits. The only barrier to this now is cost, which again will come down as insurance companies start funding it, because we can see such awesome benefits for people in terms of, again, reduced hospitalization and whatnot. So it will be cheaper for insurance companies to fund patients to be on these medications rather than trying to treat the downstream effects. So again, I think preventative medicine is right on a cusp for being radically changed. So yeah, I'm super bullish about these types of medications.
Yeah, the weight loss between those two and what they've
Yeah.
seen, it's melting away. That's going to be a very interesting one, no doubt,
Yeah.
to follow. Um,
And just to complete the
please.
diabetic chat. So, there was a lot of excitement around metformin
Yeah.
about, we were hoping that since metformin is prescribed for type 2 diabetics, it reduces heart disease, it reduces kidney disease. And the initial observational studies in humans seems to suggest that, type 2 diabetic patients who are on metformin seem to have lower rates of heart disease compared to non-diabetics, which was very exciting. So, metformin has been well studied now in humans, and unfortunately, it doesn't look like non-diabetics see any benefits at all. So there was a study called, or a program called the Diabetes Prevention Program, and this started in the late 90s, where they took high-risk patients. These were non-diabetics, but they had high fasting blood sugar levels and they were overweight, and they gave half of them metformin and the other half placebo, and they followed them up for about 10 years. There was no improvement in cancer rates, in mortality rates, in weight, in onset of new diabetes. There was no benefit seen. But then some worrying research has started to come out in the past 3 or 4 years, where if you combine metformin and exercise, you start to blunt the positive effects of exercise.
Yep.
So, for non-diabetics, I do not advocate that they should be taking metformin. If anything, it's the opposite. So I used to take metformin until that research came out. I think I stopped about a year ago now.
Yeah, I think that was a very interesting episode of yours, and once again, the fact that this is how in the real world you learn things, you modify a stack, you modify a treatment protocol, and that's once again I commend you for that in the work that you do, but coming back now because you're thinking once again metformin. A long time ago, sort of had its start from an area that I'm very passionate about, a natural product, as still 80 some odd percent of all the pharmaceutical products out there, had their origins and it's somewhere from nature. And it just got me thinking because, at the beginning you were talking about, we need to know about these supplements. A lot of them might not work, but some maybe, diamonds in the rough. Anything interesting, just, because you're down there in New Zealand, obviously a very unique sort of biodiversity ecosystem. You're in a sort of a rural population. Anything interesting happening, whether it's in New Zealand or maybe sort of the South Pacific? I know you hung out in Fiji a while ago, but any interesting sort of local, sort of ethnobotanical things pop up that may be interesting to look at? Obviously we're moving to the sort of the supplement, sort of natural product side of things, but I'm just quite interested. I don't get to travel to too many exotic places nowadays, but anything on the horizon down that way?
I think it was in Dunedin, which is in the South Island of New Zealand.
Yeah.
There was a supplement that was developed called, I think it was called Mito Q. That was meant to be essentially a better version of CoQ10, and it was supposed to help mitochondrial health and whatnot. So that was exciting. But the interventions testing program trialed it, and there was no health span or lifespan benefit seen. I'm also not convinced that we should be taking antioxidants in combination with exercise, because when we exercise, we are stressing our cells and they release all sorts of oxidants, and that seems to be a good thing. It seems to stimulate the cells that they need to become more efficient. And if we get in the way of that by loading our cells with antioxidants, it looks like we blunt the positive effects of exercise. We blunt that exercise response. So that again initially was exciting, but sort of less so now. I'm not aware of anything else from this side of the world that is particularly exciting. Again, and I'm biased here, but aside from the Rapamycin study that I'm trying to get off the ground.
Yeah, a little bit. That came from across the Pacific, but nonetheless. But speaking of that, talk a little bit. Where are you? I mean, I know you're raising money for the study. Talk about a little bit how much you're looking for, how much you've raised, and then sort of a second part to that. And I give this to a lot of people, but I just, I'd love to hear sort of the visions. You have, Brad, you have your perspective. I think it's an awesome perspective on how longevity medicine should evolve, how it should be practiced. If some of these big dollar values fell out of the sky that a lot of these groups are looking for, whether it's $1 billion, $5 billion, whatever. What is the future health span industry that Dr. Brad Stanfield would like to create beyond your Rapamycin study? Where do you think, if the money magically appeared to sort of these moonshots, what would you like to do next in terms of building up sort of the global health span system, let's say?
Yeah, so I'd want to remain laser focused. So one of the things that I would want to do, and this was recently explained to me, so I'm not from the United States, obviously. I've never practiced in the United States, but one of the things that came apparent, and I couldn't really understand why this kept cropping up in the YouTube comments, where people would say, you know, my doctor doesn't care about preventative medicine, you know, that they only want to treat me if I've had a heart attack or if I've had a stroke. And that's not my experience at all in New Zealand, where there's a massive emphasis on preventative medicine. And it seems that the incentives in the US system is not aligned with the best interests of patients. So it seems that you know, insurance companies generally, patients will only stick with them for sort of 3 or 4 years until that patient moves to another job where they get a different insurance package. So one of the things that I would love to be able to do, and I don't know how to do this, but would be to align the incentives so that there's a massive emphasis on preventative medicine. So I think that's one of the things that I want to address. But in terms of actual research and exciting molecules, so I'd first, again, taking rapamycin, because I think that's the most exciting longevity, potential longevity molecule that we've got. I'd want to first make sure that it's safe in older adults in combination with exercise. Then I'd want to do a much larger study that's multi-centered and ideally multinational over a longer time frame, say 2 years, to see, will we actually see lasting muscle performance improvements? Because at the moment, there's really nothing out there aside from just doing exercise that further improves muscle performance. And if we can do that by using rapamycin, that in itself is huge. That would be revolutionary if we can make sure that patients actually holding on to their muscle strength. If we prove if we prove that in humans, that opens up the avenue for, well, what happens if we give rapamycin to prevent dementia? What can we use it to prevent heart attacks? It opens up so much. So that's kind of the path that I would want to take with rapamycin. And also there's this syndrome called polymyalgia rheumatica. So that's an autoimmune disease that where the body starts attacking the joints. And we typically treat it with prednisone now over about a year-long period. I think that molecules such as rapamycin would significantly speed up the recovery process from things like polymyalgia rheumatica. So I would want to test that as well in that field. Then, as for sort of the next molecules, looking at hormone replacement therapy, I think is really interesting, particularly from the research that's come out, again, from the interventions testing program, where they trialed a so-called non-feminizing estrogen. And in male mice, it extended their lifespan by about 20%. It was huge. So I would want to, again, do similar studies that I'd want to do in rapamycin, but using that non-feminizing estrogen. So it's called 17-alpha estradiol. And looking at hormone replacement therapy for women, so already it's common practice now to prescribe, so it's called menopause hormone therapy for women between the ages of sort of 45 to 60. But I'd want to redo the safety studies looking at older women to see, can we still safely use hormone replacement therapy in those women, because there are concerns around increased breast cancer rates, for example. So I'd want to relook at that. Those, I think, are the most exciting ones that I can think of at this point. Everything else, I think, is underway. So we've got good research on things like vitamin D, good research on omega-3, good research on creatine. Research is undergoing for vitamin K2. So there's a study undergoing at the moment to see, will vitamin K2 supplementation reduce the calcium buildup in the blood vessels around the heart. So we're waiting on that study. So I think that there's a lot of really exciting things that are currently undergoing, but in terms of the things that are not happening at the moment, it's rapamycin and 17-alpha estradiol. Those are the two that I'd really want to look at.
Excellent. Really excellent. Brad, one thing before I let you go, I obviously we know you to be one hell of a Healthspan clinician practitioner, and also, needless to say, a Healthspan influencer. one thing I learned about you sort of in doing the research for the show is that you were one heck of a sportsman also. Cricket, hockey, squash, rugby. What do you do nowadays to stay fit, to stay active when you're not thinking about patients and thinking about broadcasting? What other things do you get involved in just to keep you
Yeah,
healthy and active?
it's tricky now because I've got a I'm running the YouTube channel. I'm working as a clinician. I've got a young family, so time is of the essence. And one of the things that I've looked at is how can we get the most what's the most efficient workout that we can do to improve cardiovascular health and whatnot. And overwhelmingly it seems to be high intensity interval training, and even ideally if you're younger, sprint interval training.
Mm.
So one of the workouts that I don't enjoy it. It's tough, but I enjoy it from the fact that I'm getting a lot of benefit in a short amount of time. Is if I go for a 30-second sprint and I
Mhm.
do that 2 or 3 times, you really stress your body during those sprints, but you're signaling to your body in a really powerful way that it needs to become as fit as possible, as quickly as possible to keep up with these sprints. So I do that about 2 or 3 times a week. I also do, I go on longer runs when I do have the time. That's sort of more for the zone 2 training. And I also do resistance training as well. So I do that mixture. And then I make sure that I'm getting enough protein in my diet. So I aim for about 1.6 grams per kilogram of body weight per day. So I weigh roughly 83 kilograms. So I'm trying to go for about, say, 130, 140 grams of protein a day. So that's quite a lot. And again, that's to make sure that I'm trying to build up my muscles as much as I can so that when I get into my older years, I've got a good baseline. So that when that muscle decline inevitably happens, I'm starting from up here as opposed to
Mhm,
down
mhm.
here. Yeah. So
Right.
it's not, again, I think it's very easy to overcomplicate diet and exercise, but I think it doesn't need to be. If you're doing some form of cardio and resistance training, multiple times a week, then you're doing 90% of what you need to. Yeah.
Outstanding. Outstanding. Yeah, no, it's a really amazing set of projects, Brad. I wishing you, not just the practice, but obviously the channel, and then of course the Rapamycin study, getting that all going. I just, really been a big fan and rooting you on with all this and sort of your goal, not just to take care of patients, but to educate everybody on these important trends and the important science. So really take my hat off to you. For everybody that is going to be listening to this particular episode of the show across the various podcast networks or watching on the YouTube channel, again, you've been listening to Healthspan medical practitioner extraordinaire, Dr. Brad Stanfield from down in Auckland, New Zealand. Check out the awesome Extend Healthspan channel. Also check out his Rapamycin trial. There's information out there. We'll put the links to it as well. Brad, I want to thank you for taking the time out of your very early schedule to come talk to us and educate us for a little while. Obviously, thank you for everything you're doing down there with your practice and the channel. And as we like to say on our show here, thanks for helping to create a better tomorrow for so many people via what you're doing. It's really great talking to you.
Yeah, thanks a lot, Ira. I hope your viewers found this talk useful. I think the parting message I just wanted to just share with everyone is that, yeah, you can't overemphasize how important diet, exercise, and sleep are. All of this health span, lifespan, aging research is very interesting. Just make sure to do the basics first.
Absolutely. An extremely important point. No doubt. Great seeing you, Brad.